Okay, so our equipment is we have a blood gas syringe with a 22 to 25 gauge needle, piece of gauze, rubber stopper, alcohol pads, and a container filled with ice for the blood transportation after. Okay, so what you're gonna do is you're gonna explain the procedure to the patient as well as do the MAT test.
Seeing the reports, coagulant must be needed.
Check patient's ID.
Check patient's ID as well and confirm name to make sure we have the right patient and that you really do need ABG on this patient. And scan chart for clotting factors, anticoagulant therapy. Okay, so you did the MAT test, right? Is he positive?
So I'm taking that to be
Okay, so now you're gonna wash your hands. You already explained the procedure to the patient. Patient is in a steady state and not emergent. The hand that you're gonna use of the patient is gonna have good pulse pressure. So check the pulse pressure. It's gonna be the non-dominant side of the patient. And there should not be any bruising or previous punctures, as well as proximal to the site of puncture, so up here as well. Okay, so ensure there are no contradictions. Rest the forearm on the table with a rolled up towel under the wrist, making sure we don't hyperextend. A local anesthetic may be injected at this point. Put on gloves, you have your gloves on. Pull back the plunger on the blood gas syringe to the desired sample amount, 1 to 2 cc's. Fix the needle to the syringe. Open the alcohol swab and sterilize gauze, leaving the gauze within easy reach where it will not be contaminated. You might as well open the gauze up too. So you've thoroughly wiped the intended puncture site with the alcohol swab. Interior to exterior of target site. Okay, now you're gonna palpate the artery and visualize where the artery is. Now with your other hand, pick up the syringe and remove the needle cap.
If the station's all set up.
Hold the syringe like a pencil. Prepare the patient for a needle stick. So you're gonna feel a little poke to the patient. While palpating the pulse, puncture the skin quickly and smoothly at a 30 degrees to 45 degrees angle. With the bevel up. You got the bevel up. Did you feel a pulse? You got a pulse? Okay, advance the needle slowly until it enters an artery, which is indicated by blood appearing in the hub of the needle. Okay, allow the syringe to fill. Once the sample is obtained, withdraw the needle immediately, applying pressure to the site with the sterile gauze. Continue to apply pressure for 5 minutes before checking the site to see if bleeding has stopped. Minimum 10 minutes if patient is on anticoagulants. If using, oh, you should have. I want to see what you do on the syringe, but okay, put the stopcock on the syringe as well. Okay, now you can put the syringe to the side or in the bucket of cold ice to keep it cool. And you're gonna move it around to mix a heparin and blood together. So you're also gonna make sure that there are no air bubbles in the syringe. It's been 5 minutes, so we're gonna check the site for any blood. No blood, so we're good. Now ensure there's no no air bubbles in the syringe with the same gauge. No, man, that's not right. So we're gonna put that gauge on top and not giving too much of a thrust. Just moving forward, not letting too much out. Once we have a wet spot, that should be cleared for the thing. The gauze should go into the yellow box thing. Now the syringe can be capped up. Place the label on the syringe and place it in the ice. Note FiO2, time, patient temperature, chart procedure, and that's it.